Friday night here, getting a little podcast in. We're gonna, I think, talk about stenosis. Gonna explain like some surgery stuff. We have something we want to start doing. We're gonna start doing these for like TikToks too, but like a medical word of the week.
Yep.
Start doing some of that. But yeah,
it's kind of funny, tonight it's Friday night, we want to get it out for tomorrow morning, and we were sitting here thinking we got to keep it going because we were looking at statistics like, what is it? 90% of podcasts, if you don't make it to 10 episodes. So we made it to episode 11.
Yeah. It's like 90% don't make it to 10 or 20, and then like 90% after that don't make it to the next 10.
Yeah.
Well, no, it's just, but that's with anything with like consistency or like how many people, start out the New Year's with a goal, and then by the end of gyms are packed at the beginning of January, and then by February, people are. I mean, you just have to force yourself. Sometimes it gets busy. Obviously, he's got a very busy schedule. You started trauma call today, right?
Yeah.
But sometimes you got to do stuff when you don't necessarily the setting's not perfect. It's where the discipline comes in. Also, I turned 26 tomorrow, so that's pretty cool.
Yeah, big birthday.
I know. So it's weird. Another thing we could talk. It's weird getting older. It like time, because the longer you're here, it all kind of starts feeling shorter proportionate wise. But
it's funny. Well, when you're younger, everybody knows this. When you're younger, you can't wait for things to come, and so it seems like it takes forever because it's the anticipation. And as you get older, you're not waiting as much for things to come. So I think time goes faster, and it just goes by a lot quicker.
And you kind of fall into a routine of life a bit, especially after college. I think. I mean, it's probably different for you, like being in medical school and beyond, because you were like so busy, you kind of aren't probably thinking like.
Yeah. But I think it's never going to go by when you're in it, and then all of a sudden it goes by in a blink of an eye. And you can say, "Wow, where'd it go?" Well,
because it's so weird thinking about like I'll pass the high school, you see younger people, they look so small and they look so young compared to you, and then you don't feel like that much older. But I remember when I was younger, looking up at like a 25, 26-year-old, you think they're so old,
right?
But
so I thought tonight we would do we'll try to just do like a diagnosis. Like, I was in a store today with my wife earlier, and some woman had stopped me. She said she follows me on TikTok, and it was surprising. And I don't know if it's TikTok or YouTube, but I said, we were asking, what do you like about my TikToks? And she said, well, I like that you actually teach us stuff and you talk about medicine and open up your world about surgery and things that we never have access to or hear about, as opposed to doing other types of things on TikTok. So we thought maybe tonight we'd just pick a common diagnosis that a lot of people have, and that's spinal stenosis. So Kevin's going to ask a few questions about spinal stenosis, and I'll try to answer, because sometimes if I talk, I'm going to miss the flavor of what maybe the average person who doesn't do spine surgery would ask, I think, Yeah,
well, I think just like with your TikTok, sometimes you're surprised when we do stuff, because to you it's just like every day,
right?
It seems normal. It doesn't seem like much. But then same with like the terms and stuff, when you and mom talking, use the big medical terms, everything. Like if you're not in medicine, it's a lot different. But why don't you just start by giving just an overview of what spinal stenosis is, what someone who might present with, what they might notice in their everyday life.
Yeah. So spinal stenosis itself, it means narrowing of the spinal canal. Whether it's in your neck or your lower back, it's narrowing of the spinal canal. And spinal stenosis, typically, my average person that comes in with complaints, I mean, probably 80 to 90% of the time, what they're going to say is, I've had this vague history of back pain over, months to years. But, most recently, over the past 2 or 3 months, I've noticed that I get pain or discomfort in my butt cheeks and my hips, and I get pain or achiness down my legs, numbness in my feet, and it inhibits you, right? So, I mean, what most people say, well, I can't stand very long, or I can't walk very long because my legs hurt so bad, or they get fatigued that I have to sit down and rest. And then I sit down and rest for a little bit, and then I get back up and go a little bit further, and I do okay, and then my legs just start to hurt so bad, or they feel fatigued again, and they're achy, and I got to sit down and rest again. And so that's how people typically present with spinal stenosis. And that's due to the pinching of the nerves. The narrowing of the spinal canal pinches the nerves. So it becomes very debilitating. I mean, there are people who get to the point where they can't walk anymore because they have so much pain. They go from walking to using a cane to using a walker and then a wheelchair. And it's not necessarily that they're going paralyzed. It's because the pain in their legs is so bad that they can't take it anymore, and so they have to be sitting most of the time. So it really can affect your life. and it doesn't always have to present exactly like that, but it's usually something where it comes on very slowly and gradually, and it just becomes very debilitating in their life, you know?
Yeah. Sorry, I just wanted to make sure the camera was recording.
Okay.
I just wanted to make sure on that. But yeah, so I think a big thing there is, a lot of people have back pain here and there. Like, I think even sometimes, like, my girlfriend would say that people my age, like, I bet, but that's not, you're going to have general aches and pains in your back.
Yeah.
It's what sounds like there is, it's the progressiveness. It progresses right to a point.
Yeah. Well, it's a lot of people say I have sciatica. So some people come in the office and say, I have sciatica. And I say, well, where's your pain? They go, it's in my back. And I say, does it go anywhere? And they say, no, it just stays in my back. I mean, that's really not sciatica. Sciatica is pain down the sciatic nerve distribution. And so true sciatica is the pain that goes down the butt, hip, and the legs. It's the stuff down the legs that's the true sciatica. And that's what surgery works very well for. But, pure back pain is not sciatica. And so I think that's a big misconception to people.
Yeah. Well, I always think that's a really cool, we've discussed this before, but I think it's really cool how you can tell by the nerve distributions and where people experience pain, where they're weak or something. So we could talk about, why don't we just start there?
So if you're going to go in and see your surgeon or a doctor about this, what I try to do, I want to find out, what distribution is that pain in. So, every nerve from the back goes in a different distribution. And so if you look at it, I have people take a paintbrush. I said, just think about having a paintbrush and paint on your body for me where that pain goes. So some people will go, well, my pain starts from my low back into my butt and it goes into my groin and kind of the inside of my thigh. And that's the third nerve distribution. So that gives me an idea what level the stenosis may be at. And then some people come and say, well, it goes right down the front of my leg, just like I have shin splints or it's just crampiness in the front of my leg. And that's a fourth nerve distribution. And then some people...
You're saying fourth nerve distribution, what?
Well, so...
What do you mean by that?
So there's different levels of the spine. So, between the second and third bone in your spine, there's 5 bones of your lower back, right? And each level, we call it like L1, 2. That's between the first and second bone. And L2, 3 would be between the second and third bone. So between the second and third bone, that's where the third nerves come off. And so when people have that pain on the inside here, you might think their stenosis could be at that 2, 3 level. People who have narrowing of the spinal canal between the third and fourth bone, that usually pinches the fourth nerves, and so they'll pain down the front of the leg. And then pinching of the nerves between the fourth and fifth bone, that pinches the fifth nerves, and those nerves go from your hip right down the outside of the leg and often onto the top of the foot into the big toe. And then the very lowest level, called L5S1, that's between your fifth lumbar vertebra and the tailbone. People have pain in their butt cheek and then pain right down the back of the leg into the calf. And so when people do that, it just gives me an idea of where the pain may be, and then I can correlate it to their MRI. Because when you're, as a surgeon, you have to make a decision, is surgery appropriate or not? So you want to make sure that the pain is going in the distribution that you would expect it to based upon what I see on the MRI. And so it's kind of like putting things together a little bit. And it's not always perfect. And there's some people that come in with pain down the back of the legs, and yet they have narrowing at a level above where you think they have it. But that's a general idea of things, and that's how I approach it when I see them in the office.
Well, that's what I was going to say too. It's a good way of pairing stuff, and it's kind of checking, because you'll perform your kind of little tests on people, have them push back against you, have them describe their pain and stuff like that to paintbrush. But then it's when you look at the MRI and it's actually narrow, that say L2-3, then you're like, okay, that makes sense.
That makes sense, right?
And then it's more likely too, if you did do surgery, that's actually going to be something that fixes it.
Yeah, because if the symptoms fit what I see in the MRI, those obviously are the people who do the best. I mean, when your symptoms fit what you see on the MRI and you do surgery, people do wonderfully. Now, if you took somebody who has symptoms that don't really match what you see on the MRI, it's less likely surgery is going to help. So you really got to try to put things together when you're talking.
Surgery too, it's about, there's no guarantee with surgery. Surgery is about creating the most likely scenario that someone's going to do well. You want to take the highest percentage chance. It's maybe there's a 20% chance of surgery doing anything. It's probably not necessarily worth it.
I mean, surgery. So even before you get to surgery, so then what's the treatment of spinal stenosis? So most people who come in with spinal stenosis and are symptomatic, if they have a normal exam, they don't have any weakness of the muscles and everything is okay from that perspective, normally we'll try therapy first. We'll do some water and land therapy for 6 weeks, and that works very well for a lot of people. I mean, I have people come in with severe narrowing of the spinal canal, bad pain down their legs, get them into therapy, they come back 6 weeks later and they'll feel 80% better. Now, it may not last forever, but certainly it's helped them a lot. And, in an older person or someone who can't have surgery, that's not a bad deal to get better temporarily with some physical therapy. And then if therapy doesn't work, you could try pain management, try some pain shots to your back, and often that can be helpful. Again, they're temporary, but can be helpful. And there's other things people try. I mean, people go to a chiropractor, which everything in moderation, right? I think a chiropractor is fine as long as it's done in moderation. Some people go to a massage therapist. Some people go to acupuncture or dry needling, they call it. Some people get light traction done. So there's a lot of different things that you can try. But in the end, sometimes those things don't work, and if your narrowing is so bad and your symptoms are so bad and the conservative measures don't work, then it's time to think about surgery. And in the right person, I mean, surgery for spinal stenosis works wonderfully. I mean, anybody out there who has those types of symptoms and who has spinal stenosis, I wouldn't be afraid of surgery because it works wonderfully in the right patient. Just got to make sure that you're the right person for surgery.
Yeah. But I think too, like right there is people I think surgeons just want to do surgery all the time, but surgery is always like your option of last resort. That's what you always say.
Yeah, and I mean not always, but most of the time. But I mean, think about it. I don't want you to come in. If I do your surgery, I don't want you to come back in a month and say I'm no better, and then come in at 3 months and say I'm no better. So when I do surgery on people, I really want to make sure you're the right candidate because I want you to come back in and feel good. Because most people after spinal stenosis surgery will feel 70 to 90% better routinely.
Yeah. Well, some of your patients, when we've done like the patient testimonials there, because I think they've just been living with that pain for so long, or it's just a nuisance to your life. You can't do all the things you want to do. So I think people are so happy because it's pretty quick. They wake up after, like some people even at the day or two after surgery, they're like moving around the house.
I mean, the best example I can give you, it was one of my best cases, but it was years and years ago. But it was an elderly gentleman who came to see me. He couldn't really walk anymore because the pain was so bad. When he came to the hospital, he literally was in a wheelchair because he couldn't walk because of the pain. So, we had talked, and he had this for a long time, and I was very honest with him and saying, surgery can help, and some people it helps tremendously, but other people maybe, if it's been going on so long, you may not get as much relief as you want. But, he'd been through the conservative measures. He had no quality of life. He couldn't walk, using a wheelchair. So he wanted to have the surgery done. So I did his surgery, and he hadn't walked for like 2 or 3 weeks. He'd been in a wheelchair. So I did his surgery. Everything went perfectly fine. I come in the next morning early around 6:30, and he's not in his bed. And I'm wondering, he's not in the bathroom. And so I started to panic a little bit. I'm thinking, what happened? Did something happen to him overnight I didn't know about? Or is he in the ICU? Or, all these crazy thoughts are going through my mind. So I went out to find this nurse. And when I'm walking in the hall, he's out there walking in the hall. And so this is a guy who wasn't walking when he came in, and the next morning he was out walking the halls by himself. So I got him back to his bed, and I talked to him, and he said, I feel so much better. My legs don't hurt. And he said, today's my birthday. He said, you've given me the best birthday present I've ever had in like 80 some years. He said, it's just, I can't believe I'm walking, and you've changed my life. But that's an extreme example of how good spinal stenosis surgery can be, but it's true. Some people are like that. So
well, and that's with that, it's you can have those cases, and you have some people who surgery doesn't really make an impact, but you take the chance when it's the setup's there, where they've got a high likelihood that it will be at least like 50+% pain reduction. I mean, it's hard to say with anything, but a lot of people, I mean, just seeing all of the patient surveys we've gotten too of when surgery does go right, it can be a terrific thing.
But it's like anything. I mean, so the sooner you do the surgery, the better people do. I've learned that. So, you take somebody who has symptoms for 2 or 3 months and do their surgery, they'll be better probably within, days to weeks. You take somebody who lets it go for 3 or 4 years and they've tried everything under the sun because they don't want to have surgery, and then finally 4 years later they decide to have surgery. Those people can take months and up to a year to get better, and sometimes they don't get that 70 or 90%. They might only feel 20 or 30% better. And it's not because surgery didn't work or do the job. Mm-hmm. It's because it went on so long, the nerves became damaged. I mean, nerves will get damaged eventually if they're squeezed long enough and hard enough. So for those of you who may have this kind of condition out there, I mean, you should talk to a surgeon. And if it's been quite a long time and nothing else is helping, there comes a point you have to decide, do I want to consider surgery or not? Because somewhere down the road, surgery won't be helpful. if you let it go too long.
Yeah. Now, so we've talked about, what an overview of what symptoms they present with. You want to talk about like actually in surgery, what do you do? So the narrowing of the spinal canal, when you look at MRIs, it looks, the spinal canal is like the
waist of an hourglass. It gets all pinched off.
Yeah, it's really tiny.
So it looks just like the waist of an hourglass when you look at it on the MRI.
Yeah, so it's very clear to see on an MRI actually, if like once you know what to look for. So you can see, and there's some like very extreme examples. But then what do you actually do with the procedure, and why does that help?
Right. So the way I do the surgery, I'm sure there's different ways that other surgeons can do it, but I think there's a standard baseline to what all surgeons do for spinal stenosis surgery. But so after you make your incision in the back, which is usually in the midline, is the way I make it, in the middle. Then you come down, and whatever level you're going to do, you have to expose the bone over the back of the spine. So the bumps you can feel on your back, like if I push on my back, there's those bony bumps in the middle. Those are called the spinous processes, and that bone is attached to what's called the lamina bone, which overlies the back of the spine. So we all have bone over the back of our spine. So the first thing I do is expose that bone. So the muscles are attached to the bone. You kind of separate the muscles from the bone, let the muscle drift off the bone, and then get retractors in that hold the muscles back. Now you're looking at the bone. And then you take an x-ray, right, with some markers to mark where you're at so you know 100% you're at the right level.
And what now? So they do the x-rays mid. So like once you've done all that, then they stop and then that one.
Yeah, we stop for a second, and then we'll have the x-ray team come in and take a sterile x-ray, make sure we're at the right level. I mean, that's how I do it. Maybe some people.
And what's the important? That's a safety check, right?
Because you don't want to have surgery done at the wrong level. I mean, if your narrowing is at the 4 or 5 level and somebody does your surgery at 3, 4 level because they didn't take an x-ray, you're going to wake up and not feel better. So, I mean, I'll always get an x-ray. There's been times I'm almost positive I'm at the right level. I still do an x-ray because every once in a while you're just not where you think you are.
And that's just being like doing all those extra safety, because so much can go wrong if you're doing something where there's not a problem.
Yeah, it's just, I mean, I don't know if it's a standard of care, but it's my standard of care. That's what I do. So once I do that, then you have to take the bone off the back of the spine. And we have various instruments that bite the bone away. I use a drill to thin the bone off. What I'm trying to do is I'm trying to open the spinal canal. So usually I'll take the bone off in the middle at first so I can see the spinal sac. And once I get the spinal sac exposed a little bit, you can see how narrowed it is. I mean, honestly, it looks just like the waist of an hourglass being all pinched off. And then
another good example, like a straw.
Yeah.
And then if you like pinch that straw closed, it's like that, because it's like there's this opening, and then so you can't get, there's like not that there's anything flowing, but it's just completely pinched like that. So
or if you think about one of those long balloons like a clown blows up and it gets really long, if you took your fist and you squeeze the middle of that balloon, right, that's what spinal stenosis would be. It's normal above, normal below, and then narrowed right in the center. And so once you start to take that bone and tissue off the back of the spine, so when you start to lift that bone off, you can watch the spinal sac just balloon right back up at surgery. So when I'm done with surgery, the spinal sac is back to its normal size. I just had a great example this week of a lady who had bad spinal stenosis, and I mean, it was worse at surgery than it looked like on the MRI, but it's how slow you have to go. Just bite that bone off very slowly off the top of the spinal sac. But as I did it, you could just watch the spinal sac just balloon right back up.
That's pretty crazy. That's pretty cool. So
so you have to be very careful, obviously. But I mean, she did great. I mean, she went home the next day and her leg pain was already better. She was out in the halls walking. So you're basically taking the bone and tissue off the back of the spine to open up the spinal canal and unpinch the nerve. So that's how we do the spinal stenosis surgery. Some people, if they have a slippage of their spine or some instability of their spine, they might need a fusion with rods and screws. But I'd say most people I do spinal stenosis surgery on just need a simple, what's called a laminectomy, where I just take the bone off the back of the spine to open up the spinal canal. For most people, if it's 1 or 2 levels, the surgery takes an hour to an hour and a half to do. Usually I'll keep the patient overnight and they go home the next day. On occasion, I might let somebody go home the same day. But
what now? A couple other questions. So when you take that bone out, does that go like medical waste? Do you know what happens to that? Like,
Yeah, I think it just gets thrown into a medical waste garbage. I think but it's not. I don't think it's.
It's like what's the most you've ever taken off? Have you ever taken off had to take off almost all of around?
I mean, I've taken off 5 levels of the back. So if the lumbar spine is L1 down to the first sacral S1, I've taken all that bone off.
So how much material do you think that is? Or
I don't know.
Bone wise, do you think that did it fill a tray up or?
No, because I take it off in piecemeal. I take the bone off piecemeal, and I use a drill, so it's hard to tell how much comes off. But they have to show you a spine model to see it. But
and then finishing up, Hayden's about to join us in a second too. Yeah. But just the last thing would be how to finish the surgery off. Once you're done with that,
right?
You just suture up, right? Close up the person.
Yeah. So once you're done with surgery, then the next step is really take your time. Is to stop any bleeding, right? So you take your time to stop the bleeding, both before I take the retractors out and then after I take the retractors out. I always look around, make sure there's no bleeding. You irrigate the wound out real well. And then once you do that, you sew the muscles and what's called the fascia. So there's fascia is not a tendinous material, but it's attached to the muscle. And so when you pull the fascia together, you're pulling the muscles back together. So I sew that layer together. That's down deep. And then I sew the skin together with dissolvable stitches. And then sometimes you have to put staples in or just stereo strips, which are little pieces of tape. He's muscling in.
Yeah, no, we got Hayden joining us, my sister's fiance.
But anyway, so you sew things up in layers, then you put a bandage on, and that completes the surgery. So that's kind of a nutshell of spinal stenosis, what it is, and treatment options, including surgery. And for some people, surgery is a big deal. It's a big deal in their life, but it can change their life too. I mean, when you get to the point where you can't exercise, you can't play with your kids, you can't go to the grocery store because it hurts so bad, or you can't even walk across your own, house to your bathroom because it hurts so bad. I mean, it really changes people's lives. And anybody who has it out there right now, I mean, what it feels like. And anybody who had the surgery, who's had the surgery and done well, will know what a difference it can make.
Yeah. But yeah, if you like kind of overviews like that, let us know. We could do some of his other conditions you do regularly or some other things. But let us know if you like that, if you find that informative.
And if you did watch this podcast and you want to have a few questions, you could leave some comments or questions. We'll try to answer them for you.
Yeah.
Do our best to do that.
And again, obviously, this is not medical advice. It's just his opinion on the way, how he does stuff. Because obviously, you can't give
everybody does it different,
but if you are experiencing that, you would say the first step for people would be to see their primary care physician.
See your primary care physician, and then if they think you have something you need to see a neurosurgeon for, they will have you see a neurosurgeon, or they may say maybe try some therapy first. So always touch base with your regular doctor.
But like you said too, the importance of not waiting too long. So if you do think you have some issues, take charge of your health. Yep. Your health is so important. You might not. No one likes going to the doctor, but sometimes just getting the ball rolling, it takes some time. Mm-hmm. So good to do. Okay. But we're joined here now by Hayden. We're going to switch gears a little bit. Hayden is in college right now. Do you want to? This is your first time on the podcast, right?
Yeah, first time on the podcast.
His maiden podcast. Yeah, you got to talk a little louder.
Okay.
But what's it been like starting school again? You want to tell people about what your aspirations are?
Yeah. So I think I've been out of school for a long time, and I had the idea of wanting to go into healthcare for as long as I can remember, and I kind of just really went for it this year because I felt I had the support necessary to go through it. So, I'm doing a biology degree for an undergraduate right now. Hopefully, med school after that.
So this is your first quarter, right?
Yeah,
Is it semester?
It's semester.
Yeah, okay, so they call it, okay. So you started in August, right? It was August, right? So then 2 months?
Yeah.
All right. What's the first 2 months been like?
He's been getting good grades. He's been getting commended by the...
Well, he only got a 92 on the test the other day.
I know.
Sorry, I gave you away.
I know. I'll never make it to med school.
No, that's excellent. You get straight A's.
We're like midterm right now. I've had, I just did my math midterm. I don't know. It's a lot. I don't want to jinx it, but it's been a lot easier than I expected. I think I worked it up in my head more.
Mm-hmm.
I think a lot of it is just showing up.
Yeah.
And
but you and Christy both have been pretty diligent. You guys are both obviously putting the time, like, to make it. It seems easy when you're putting in the time and doing stuff, but if you let yourself fall behind, it can build up a lot.
Yeah.
So what do you think for like because there's always people out there who we get questions through the last year about, I'm in college and I want to go into medicine, maybe be a neurosurgeon or be a doctor, and so you're doing it. I mean, they're thinking about doing it in high school, or there are people who just start in college. So how are you preparing to get to medical school? Like, what did you have a counselor that helped you with classes? Or for somebody out there who's really wondering, I want to be a doctor, I'm just starting college or going to start college, how do I go about planning to get the right courses so I can make it to medical school,
Yeah, so
because you're doing it right now, so.
Definitely initially, like when you are enrolling in college, going through the right avenues to like declaring your major right away, because you don't want to go in and be undeclared and take a bunch of classes that you don't need. And then talking to your academic advisors, just saying, hey, I want to be on a pre-health track, specifically for medical school. But I think most of it, it's all encompassing. So if you are on a pre-health track, usually those classes are all prerequisites for like PA school, medical school, podiatry, like all of it.
So you had a specific advisor who told you what classes to take, or did you pick them out on your own?
So when I enrolled, I just when I was going through the process, I just listed my major as a biology major, and then on a pre-medical track. And then when I went in for orientation, they had all of us that were assigned to this academic advisor come in, and they had plans set up for us already. So depending on where you're at, how you scored on your pre-high school stuff, you'll probably be in different classes than some of your friends, maybe depending on how you did on the ACT or what class you took in high school. But generally they're going to come up with a 4-year plan where you meet all the prerequisites.
Yeah, I remember when I went to Ohio State, there's resources online, like you can see all the different things you need to get for different majors and different minors. It can be confusing to look through sometimes, but definitely getting acquainted with that, so you're not just relying on advisors too, because also there's people I know who put a ton of time into it. They would try to pick out the teachers they wanted. Like there are some teachers who are like different. A lot of people took this one art class for the art credit. Which it was funny. There was this one, it was like Italian history or Italian movie history. So that was a class a lot of people like to take. You just watch movies and then critique them.
Sweet.
But there's different ways. So yeah, I think speaking with your advisor and using those resources, kind of taking charge of that, because you hear it about it all the time. But some people be like, oh, I wasn't even taking. I don't have all the things, or I had to take an extra semester because they didn't even realize they weren't on the right track.
Yeah, and that's a shame, because you put all this effort into 4 years thinking you're going to be prepared to go right into the next step, and just fall short. Not really, because of you, but because of a lack of communication with an advisor.
And has anybody told you, like, so I'm so far away from it, I mean, has anybody told you, like, what do you think your GPA realistically has to be if you're going to try to get into medical school? Like, have they told you what a minimum GPA would be at the end of college? Or
so I've heard a couple different answers. I'm personally going off of what's posted on the website for the medical schools that I'd be interested in, and I think a strong application is like a 3.8.
Huh. Yeah, that's in a hard undergrad too. It's not. So no, it's really becoming it's. I have some very smart friends who were waitlisted for a couple of years or didn't get into medical school, or some I think who just kind of decided they weren't going to go into medicine anymore you have to. It's super competitive. There's more and more people, and a lot of people want to go into medicine, so it's a very competitive field.
They're not just looking at it's kind of broader than just academics, because you can have a 4.0 GPA going into it, and that's great, but if you don't have any of the other things they're looking for, you're going to be put on the wait list or whatever. They're not going to look at your application seriously.
Well, and you're starting in a lab, right? You're going to do some volunteer work in a lab.
Yeah. So I start the week after fall break.
And how did you tell people about how you took some initiative there? You've been messaging people or emailing people, right?
Yeah. So I know people that have gotten into med school without any research experience at all. I know that it's something that they look for, and I wanted to do something that I was interested in. So I started emailing all the professors. I went to the undergraduate research department and looked at all the professors, looked through some of their publications, and just seeing what they do and whether I'd be interested in it at all. Because obviously not everything is going to be very interesting to people. So I specifically wanted to do something that focused on like cancer research, and it just so happens the department chair for the biology sciences does cancer research, looking at markers in asymmetric cell division and some stuff that's kind of over my head right now. But I can ask plenty of questions.
I think that's what's so great about just college in general, but especially if you put yourself in those environments where you can just absorb things. You got to start somewhere where you don't know anything, and you just slowly being around that environment, and a person like that who's obviously very smart himself.
Yeah, I mean,
learn a lot.
I don't think he kind of told me they don't really expect anybody coming in, especially first year. There's not a lot of people coming into those labs as freshmen. They don't really expect you to know everything.
Yeah.
But I'm just excited to be there and kind of see what I can learn along the way.
I think that's probably what the biggest thing people look for too, is the eagerness to learn and to improve, grow. So
what's been your favorite class so far?
I enjoy my biology class. I think it's a little much. I'm not a big fan of these huge lecture halls where they're like a million different people in there, and some people aren't paying attention, so they're like talking in the back. It's a little distracting. I mean, get over it. But personally, it's funny. My favorite class right now is world religions. I find it really interesting.
Yeah. That's cool.
And what's it been like? Because I see you guys studying. So it's funny. Like Christy will be over there studying something totally different than what you're studying.
Yeah.
It's because you're not in the same class or anything. So what's that been like? That you guys both studying, at night? And
it's every day is different. But Christy is definitely has more credit hours and she's taking more credit hours, so she's studying longer than I am. Usually by 9 o'clock, or like once I feel brain dead and I'm not retaining information, as long as my assignments are done and turned in, I'm done. I'm done for the night. But it's cool because some of her classes have some overlap in what my classes are talking about. So she'll have me quiz her on note cards, or I'll hear her talking while she's taking notes, and I'll put some input in. So it's a collaborative thing.
Mm-hmm. You got any trivia for him? You got any the stuff you learned? You think you can stump him with?
I don't think so. I went out the other day.
Christy stumped me on some stuff.
Do you think being around, my mom and dad, when they talk the medical terms and all that, that's kind of giving you more familiarity, or are you not in any classes yet that really touch upon stuff?
I'm not really in any classes that touch on it, but I feel like it's almost like a leg up. Mm-hmm. You know what I mean?
Yeah.
And I also find it really interesting whenever I remember you coming home talking about how different ways the differences between how you do a certain surgery versus how maybe a partner does a surgery. Yeah. Just hearing about it is really interesting.
Yeah. You got anything else you want to share? Or?
No, I figured I'd stop.
So we were gonna do. Let's see. Let's
talking about.
I was because I want to go do this thing. We were gonna start doing. It's like a medical term of the week. Do you have one then? Let's see if he knows it. Okay. I don't know what it is yet, but I probably won't know it. But I'm not.
I'll just throw some terms out
Just know you gotta pick one.
Okay, encephalitis.
Swelling of the brain.
Okay, that's not swelling of the brain, but anyways.
Christy's in the background trying to guess too.
I'll be honest.
Fluid in the brain.
No, but it's
I've heard it a lot, but I don't know what it is.
So it's just a general term for like inflammation of the brain.
Oh.
So inflammation can cause swelling, Christy, but it's still inflammation of the brain. Itis means inflammation. Tonsillitis, what is that? Inflammation of the tonsils. Gastritis.
No, but that's why I think
inflammation of the gastric lining.
Well, no, but that's kind of why I want
esophagitis.
Okay.
Inflammation of the esophagus.
But that's kind of the point of why I thought it'd be interesting to start doing like a medical term of the day would be too much. A medical term of the week we could do, because that's what people I think miss sometimes is these words seem super complex and crazy, and they aren't a bit, but a lot of times there's a logic and reason to each one. And once you know that, like the layout of stuff, you can start to understand.
Or even just knowing, like you hear all these terms, so a lot of people don't know itis means inflammation for the most part. So anything you put itis on, bronchitis, inflammation of the bronchioles. So little things like that.
Well, it's etymology, which is pretty cool. And then because it helps a lot with knowing stuff.
So we've heard about like my college experience so far. How do you think your guys' experience has differed from what it looks like for Christy and I coming home?
Well, I can tell you the biggest thing from what I remember is that we went to class. We had to go to class, and all our tests were in class. Like there was nothing. Well, computers. When did Apple computers start? Like 86 or something. So I mean, there were no computers.
We're ancient.
Yeah, there was no laptop.
So I'm just saying, everything was done handwritten tests. They were great. Most tests were graded by hand. Had to be in class to get the notes. If you weren't in class, you weren't going to get the notes, and you weren't going to know what was on the test. So we had readings and stuff. I think that's the biggest difference. You guys are online. A lot of your tests are online now. Didn't you just take a test, or Chrissy took a test online? Not even at class. So that's the biggest difference.
Usually it's just a lot of times, so many assignments, so many. Do you guys use Blackboard, or which one do you use?
Yeah.
We use something else at Ohio State, but there's usually an online platform like that. A lot of teachers with the textbook, they'll have you buy the online access too, because they like Cengage is a huge thing, and they have you. I mean, I sometimes think some teachers are a little lazy. I think it assigns all the homework for them and auto grades for them. Like they do everything through that, so that is annoying. But
it's funny when you say Blackboard, what you're referring to too.
It's just like an online software. So like
right, isn't that crazy? So when I think of Blackboard, we had blackboards, and the teachers would write with chalk.
We had blackboards. I had blackboards in high school and elementary school. I mean, we started getting smart boards. But, but I mean, everyone knows what blackboards. A lot of teachers still, like my accounting teacher always just used the Blackboard. He was so funny. He would at Ohio State. If someone like came in late and like messed up, he'd just like leave. Or like someone's phone goes off, he's like leave. He'd publicly shame them. It was so funny. I think it's funny too in the huge lecture halls like you're talking about. It's so funny what people are doing all the time. There's people online shopping on their laptops. Yeah. There's people playing video games. It's like, why are you even showing up here?
Yeah, I sat like I didn't sit like right up front the first day, and I thought like all the people that were gonna be there were gonna be there. So I was in the end cap of a row, and like 80 people showed up like 5 minutes late because nobody could figure out where the room was.
Yeah.
And it was a mess. So like after seeing what people were doing and just like feeling like the professor was getting drowned out by all this noise behind me, I was like, I gotta sit closer up front because it's a little ridiculous.
I think there's just a major difference between showing up to class and being present in class. Same with like if you being attentively paying attention, taking notes, actually engaging with what you're learning. Because it makes such a vast difference. People are like, oh, like I don't even know what's going on. I'm like, you're talking the entire class, you're like texting on your phone, playing games. What's that? You're not really, I'd rather make the most use of my time. If I'm going to have to sit in class, I'd rather make the most of it. And I think the same is with studying. I used to like study alone most of the time, and people are like, let's go to the library. Because most people go to the library, they're studying for 5-10 hours. They're like, I studied so much for this test. I'm like, you didn't study, you were socializing.
Right.
You're not like focused. I'd rather take 2 hours of focused study time than sit with friends and study for like 12 hours. Unless the only time I would with people is more so is if I've already known the material, then like explaining it with them or teaching it back and forth can be powerful. But when you're trying to learn it becomes that focused learning time is so much more powerful than doing it with just people. And
for sure, because it becomes a social. Even when I went to school, it was a social event sometimes. If you really want to study, you go by yourself and just, for me anyways.
Yeah. Well, it's not, it's one of those things. It's not like everything in life's not fun. Like that's not something that's meant to be fun, but it's cool in a different way, like learning stuff and actually trying to, because you have to think too, a lot of times some people get stuck in the mindset of just trying to do good on a test, which is okay, but trying to understand things deeper is the true point of learning and retain it long term to improve your ability to do something.
Yeah, application. And it's incredibly rewarding. Like, even though it is sometimes very boring, it's incredibly rewarding to see that work pay off, even in the short term.
Mm-hmm, definitely. Yeah. I mean, I think that's what's good about school, and that's what's too bad. It's like after school, and there's that feedback system where you get grades and stuff, so it forces you to do stuff, and you get to see, like, am I doing well or not? It gives you a real-time feedback, like if you need to change something or not. Or if you're doing well, if you're getting A's, then keep doing what you're doing. After, like, college or the highest level of school you complete, I feel like a lot of people, there is nothing like that to learning anymore. You're not forced to learn, so people don't, like, follow their interests and stuff. Yeah. They just kind of fall off from where because learning seems like a chore in a way. It's in people.
Yeah, it's interesting. Like, I don't know. I feel like I do, like, passive learning, like looking at articles and stuff, but I in the social media realm, like, especially before I started school, like, if I worked a really long day, like, I'm not looking at anything that's informative on, like, I'm looking at, like, stupid stuff on TikTok, you know.
Yeah. I mean, there's nothing wrong with enjoying yourself or, like, watching Netflix and other stuff, but I think it is good, like, long term. I think sometimes you feel like your brain feels fried, like when you just are only consuming, like, these really, like, mind-numbing things, some things you see on social media. But that's and kind of like how you create your mind and your life is what you consume. If you consume bad food, bad information, just kind of garbage, then you don't feel as good, even though it might feel good in the moment. So, but no, I think it's really cool. I always love something about being like a nice old university, a college in America. I love all, like, the old architecture. You're just surrounded by so many things. Like, I love seeing the libraries. I love seeing the business schools and the medical schools. Seeing all that stuff, there's, like, kind of an aura or a feeling of being on campus. Like, you're all there to learn.
There's history there too.
There's history, and there's just kind of the power. I think it's so cool when everyone's coming together to learn. You get to engage with so many different types of people in different fields, diverse backgrounds. So it is a really cool time to get to experience all that. So, but yeah, I think that's the end of the episode.
The wrap for tonight.
Thanks for watching and listening. And as always, any suggestions you may have, some words of encouragement to Hayden as well.
That's right.
So, but all right, bye guys.
Yep.